Hello, my name is Tamas Szakmany, the Associate Editor for Social Media at Critical Care Explorations. Here are my top reads from Critical Care Explorations this month. A multicenter observational study from Spain by Jesus Villar and colleagues found that acute hypoxemic respiratory failure is a common problem, with approximately 13% of patients admitted to the ICU suffering from this condition. The study found that ARDS was less frequent than previously suggested. Both acute hypoxemic respiratory failure and ARDS had high mortality, despite the use of lung protective ventilation strategy and higher PEEP. Adjunctive therapies such as proning were rarely used in this cohort of patients recruited in the pre-COVID-19 era. Krista Haynes and colleagues investigated the use of enteral nutrition in 75 US hospitals during the first wave of the COVID-19 pandemic. They found that those mechanically ventilated patients who received early enteral nutrition had shorter length of stay, spent fewer days on mechanical ventilation, and had lower associated costs. Concerningly, approximately 40% of patients did not receive enteral nutrition even by day 3 of mechanical ventilation. As there were no significant imbalances between the patient characteristics in the early and the late enteral nutrition group, these results suggest that early feeding of COVID-19 patients who accumulate significant calorie deficit during the stay early might be an easy way of improving outcomes. Nakamura and colleagues investigated in a small single-center study if the complement cascade activation could be used to monitor and stratify heat-related illness in ICU patients. The complement activation has been shown to be associated with worse outcomes in sepsis and respiratory failure. However, the Japanese study was able to elucidate for the first time that soluble CD59 and C3A, C5A, and soluble C5b could be associated with multi-organ failure in heat-related illnesses, compared to the conventional complement tests. They also found that soluble CD59, an important membrane-anchored regulatory protein of the complement system, might be a novel marker of heat-related illness severity. Please take time to read these articles and more by visiting ccejournal.org. Also, follow us on social media at CritCareExplore. Stay safe, everyone.